And then I guess I'd also want to ask about birth control.
Yes.
Because we've heard things that, at least growing up, I know I'd hear things like, oh, if you take it for longer than 6 months, that's it. Or if you take it for longer than 2 years, and it's so contradicting. But does long-term use of birth control affect a woman's ability to conceive and to get pregnant?
This is actually a misunderstanding,
Okay.
number one, because birth control, unlike in some other quarters, where they say birth control is actually only used for, for controlling, the number of children you can give birth. And so it is better for spacing the number of children, not really controlling. Controlling, say, okay, you have 3 children and you don't want to have any more and so on. But we use it in other very many areas as well. We use it, for example, in a patient who has very heavy painful periods. It is used to help that. We use it to control now the cycle. So, for example, you're having your wedding and your what is it called? Honeymoon is coming up, and that is the period when you're supposed to have your menstrual flow. You can actually use pills. Pills to actually to control it.
I've heard it as well for acne. I've heard people say they use it for skin and acne.
Yes. There are some specific tablets which are sort of engineered to help, with acne. But you have to use them for some time.
Okay.
Coming back to your question, does it affect fertility? By using the hormones themselves, whether we use patches, whether you use tablets, or whether you use injections, they actually stop your normal cycle from the physiology of the normal cycle. But once you have stopped using these medications, and after some time, it depends, it varies from patient to patient. Usually it takes 2 months, 3 months. In some extreme cases, it can take up to 6 months for your cycle to come back normally.
Okay.
So once your cycle comes back normally, then you can actually try to get pregnant. So taking contraception per se, or hormonal contraception per se, I think it's a myth which has been, bandied. It has been that it will stop you from having a baby and so on. Of course it will, in the sense that your ovaries are not working. The physiology, your normal physiology is not there. But once you have stopped taking the hormones and your periods have come back, you should be able to have a baby.
Oh, I was on the team that believed that it does affect your...
Actually, on the contrary. If you look at research, it is out there and it is clear that sometimes when you have been on oral contraception for some time, once you stop, the chances of you getting pregnant is a little bit higher, and the chances of even having multiple pregnancy is also slightly increased than in the normal population. There is research out there, and it is out there for everybody to see.
Right. Well, busting myths over here.